Imagine quick relief, a shortcut to pain, a solution that seems within your grasp, right there on the medicine cabinet shelf, or from a well-meaning neighbor's tip. For many seniors, self-medication and old family remedies represent a powerful temptation. It's the promise of immediate comfort, without the bureaucracy of a doctor's visit, the trust in something that always worked. But what seems like a shortcut can, in fact, be a dangerous path, paved with invisible risks and devastating consequences. The strong belief that I know my body, or this natural remedy won't hurt me, is one of the greatest dangers. At a stage of life where the body is more sensitive, where medication can act differently, and where multiple health problems can coexist, self-medication isn't an act of independence. It's an act of playing Russian roulette with one's own health. Years of accumulated experience don't grant immunity from the dangers of a lack of professional guidance, and grandma's remedies can have unexpected and harmful effects on senior health. The counterintuitive statement here is that seeking quick, unsupervised relief can actually prolong suffering and create far more serious health problems than the original ones. What seems innocent can be a minefield of dangerous drug interactions, inadequate dosages, and delayed correct diagnoses. Are you ready to uncover the hidden dangers behind every unprescribed pill and every friendly but unprofessional medical tip? This video is an urgent warning. We'll expose the traps of self-medication and old family remedies in older age, showing how these seemingly harmless habits can seriously compromise your quality of life and even your longevity. Your health is too valuable to be left to chance. If you or someone you love uses medication without medical guidance, this video could be a game. Keep watching to understand the real risks and how to protect yourself, and so you don't miss any of our content that truly makes a difference in your health and well-being. Do this. Subscribe to our channel now and hit the notification bell. The dangerous math. Inadequate dosage. One of the most immediate and common dangers of self-medication is inadequate dosage. What's a safe dose for a young adult might be too much, or too little for a senior. Metabolism changes with age. The body processes medications differently, and the kidneys and liver, which are responsible for eliminating substances, may not function with the same efficiency. Taking the wrong dose of a medication on your own can lead to intensified and dangerous side effects. An excessive dose of a pain reliever, for example, can cause kidney problems, while an insufficient dose of blood pressure medication might not provide the expected benefit, putting the senior's health at risk. Furthermore, inadequate dosage can render treatment ineffective, prolonging suffering and masking the real need for medical intervention. The belief that more is better or half won't hurt is a serious mistake when it comes to medication in older age. The silent confrontation, dangerous drug interactions. Imagine an invisible minefield. That's the analogy for dangerous drug interactions. A very high risk with self-medication, especially for seniors who often use multiple prescribed medications. Every new remedy introduced without the knowledge of a doctor or pharmacist is a risky gamble. Mixing medications without medical knowledge can lead to unpredictable and severe reactions. A headache medicine might cancel the effect of a heart medication, or an anti-inflammatory might increase the bleeding risk of an anticoagulant. These interactions can be silent until the damage is done, leading to hospitalizations and worsening health. Old family remedies, passed down through generations or from neighbor to neighbor, can also contain substances that dangerously interact with medications the senior already takes. That miracle tea might not be so harmless when combined with a diabetes medication. For example, the deceptive mask, delayed correct diagnosis. One of the most insidious impacts of self-medication is the delayed correct diagnosis. When a senior uses a remedy that masks the symptoms of a serious illness, they lose the opportunity for an early diagnosis and effective treatment. Think of chest pain relieved by an antacid, when in fact it could be a sign of a heart problem, or constant dizziness attributed to old age and treated with some tonic, when it could be a symptom of a silent stroke or another serious neurological condition. These temporary reliefs create a false sense of security, allowing the underlying disease to progress undetected. When the true problem is finally diagnosed, the condition may already be advanced, making treatment more complex, less effective, and seriously compromising the senior's quality of life and longevity. The harmful, unknown, unexpected side effects. When a medication is taken without professional guidance, the senior is exposed to a range of unexpected side effects. Each body reacts uniquely, An advanced age can make the body more sensitive to certain substances or lead to adverse reactions that would be rare in other age groups. These serious adverse reactions due to lack of professional guidance can range from severe gastrointestinal problems, dizziness and imbalance, mental confusion, excessive drowsiness, to damage to organs like the kidneys and liver. What would be a solution for a minor discomfort can become a new and serious health condition. Furthermore, a lack of knowledge about the senior's complete medical history exponentially increases the risk of severe side effects. What works for one person might be poison for another. The trust that warns the importance of professional guidance. Given all these risks, the message is clear. Senior health demands caution and essential care. Trust must be placed in qualified health professionals, doctors, pharmacists, nurses, who have the knowledge to assess the senior's complete picture, considering all their conditions, medications, and peculiarities. Avoiding self-medication and questioning old family remedies is an act of responsibility, and it's about seeking the correct diagnosis, the appropriate dosage, and the necessary safety so that medications are allies, not villains. In the journey towards greater quality of life and longevity, your life is invaluable, and every decision about your health deserves the best possible guidance. Self-medication and adherence to old family remedies may seem like convenient shortcuts, but they represent real and complex dangers for senior health. From inadequate dosages and dangerous drug interactions to delayed correct diagnoses and unexpected side effects, the risks far outweigh any apparent benefits. Your health in older age is a treasure that deserves to be protected with the utmost caution and knowledge. Don't rely on chance or unscientific advice. Prioritize guidance from health professionals to ensure that every step towards well-being is safe and effective. Did this video help you understand the dangers of self-medication and the importance of seeking professional help? Then don't keep this vital information to yourself. Share this video with your friends and family, especially with those you know self-medicate. Your action can save lives. And to continue receiving content that transforms the lives of seniors, don't forget to subscribe to our channel and hit the notification bell. Your health deserves the best care. Senior health matters.